a nurse or male or female doctor to take the isotomy position, cover the patient, and start your work.
And refers to the direct vision.
Now, patient in a isotomy position, cover. What are the first thing? First thing, use your eyes. Very important. Careful inspection to the vulva, to vagina, perianal area, and cervix. Why? For any abnormality in additional to human papillomavirus can have addition. Start with your eyes. The second, introduce the speculum. Please don't use gel. Lubricant is tap water. It is the most suitable one. The gel interfere with the interpretation of the result, and the end result is unsatisfactory. If it is mandatory to use gel, please apply in the way not affecting the cervix, but it is not recommended. Now, you introduce the speculum. Our target of work is the cervix, endocervical and ectocervical. Two samples will be taken. Endocervix, why very important? Because adenocarcinoma now increased, representing from 10% to 25 to 30% relative to squamous cell carcinoma. Ectocervix, where we concentrate about squamocolumnar junction and transformation. I need to stress about this point. This is the picture seen. Original squam, this is the endocervical, internal os, transformation zone, original squamocolumnar junction, and the old one. Our work here and here. Endocervical lined by columnar cells where adenocarcinoma appear. Squamocolumnar junction, this is the new one. Original not seen here, and squamocolumnar and transformation.
Vagina. It is cylindrical in shape and is approximately 3 to 4 centimeters long and 2.5 centimeters in diameter. The part of the cervix outside the womb, projecting into the upper part of the vagina, is mostly covered by several layers of squamous cells, the same sort of cells that form the surface of the skin and line the mouth and the vagina. The inner part of the cervix is lined by tall, mucus-secreting columnar glandular cells arranged into a complex, highly folded lining. The point where these two types of tissue meet is called the squamocolumnar junction. After puberty and during the early childbearing years, the inner columnar glandular lining moves towards the outer cervix, where, over time, it is gradually replaced by squamous cells. The area where this change occurs is called the transformation zone, and it is the area most susceptible to human papillomavirus infection, the main cause of cell abnormalities in the cervix. Cervical screening involves taking a sample of cells from the cervix to look for abnormalities that, if left untreated, could lead to cancer.
Now, how the endocervical sample is taken? Either using brush, or if not available, using cotton capped applicator, or using a specific spatula. This is for the endocervix, and this is for the ectocervix in the same setting. In our area, either we deal with this or with cotton capped applicator. Now, how we introduce the brush? Brush introduced into the cervix by certain conditions. Observe. The first one, the last bristles of the brush are visible. Don't introduce so deep. So the last bristles must be seen. The second, degree of rotation. From 90 to 180 degrees, not more. Why? If we rotate more, this was bleeding. Even RBCs will affect the result. The third, the sample is rolled on a slide and not fixed, but immediate fixation. I will shift to ectocervix, how I take the sample from squamocolumnar junction and the transformation zone. My tools is a spatula, either wooden spatula, or spatula as mentioned, or the plastic spatula or many types of spatula. I need to remember that I apply for 36 degree in clockwise. The brush 180. The spatula 36 degree. Not so vigorous cause bleeding, not so tight, so no cells appear. You must smooth. Deal smooth with the cervix. It will deal smooth with you. Here, this is iris spatula and Ellsbury spatula. What is the difference? The tapered end here produce endocervical sample better than this. So it is suitable in postmenopausal woman where the transformation zone and squamocolumnar junction is high up. While this is suitable for multiparous os where transformation zone is wide. So we can use the spatula according to the situation. Many types of spatula. Tapered end produce endocervical sample than the non-tapered end. How spatula is applied, how the squamocolumnar junction original and new, how transformation zone is taken, rotate 36 degree smooth one. After that is bleeding and fixation. Regarding splitting, there is certain technique for splitting. From the spatula, a smooth movement from side to side. Not go and up, because this disturbs the sample. Smooth from here to here and from here to here. Regarding the brush, rolled in the brush. If we do like this, what are the results? What is the result? The result is a smooth film satisfactory for sting. Okay, if I take this with immediate fixation, the result will be satisfactory. But I need to look like this. If the cytologist found the sample like this, it is unsatisfactory smell. Why? Because I spread the sample in a rough manner, so it is collected in multiple layers and fixed it doesn't reach. The second, please remember, not fixation, but immediate fixation. Why? Because there is what is called drying artifact. If I leave the slide in the air, it will be dry, and this artifact will appear unsatisfactory result, like called brown precipitates appearing in the nucleus, and this brown precipitate due to delayed fixation and the drying artifact. So, immediate fixation, not fixation. After that, I will review the request. Very important data must be written, including clinical patient information, clinical details, and sent to our colleague, the cytologist. I need to concentrate about 36 degree. Some mistakes in this video, like rotation more than 36 degree, the brush more than 1/8 of the step.
Then use a brush to sample the endocervical canal. Spread the specimen on a glass slide, making as thin a preparation as you can. Spray the slides immediately with fixative to avoid drying artifact.
I need to pay attention that there is workshop by our colleagues, Fatma and Zainab, I would say during coffee break, also to have a look how the spatula is appeared, how the brush is appeared, what is the fixative, and the scope of CD with the colleagues outside after the end of first session. Now I will shift to what's called liquid business cytology, approved by FDA in 1996. It is not like the traditional one. Simply the sample is taken and putting in container, this container containing fixed fluid sent to the lab where the sample is produced in monolayer. Not several layers, but monolayer. This is samples of how liquid business cytology is taken.
Cervical specimens collected using either a broom-like device or an endocervical brush and plastic spatula combination. The broom-like device is designed to collect ectocervical and endocervical cells from the cervix. Obtain an adequate sample by inserting the central bristles of the broom into the outer bristles to fully contact the ectocervix. Push gently and rotate the broom 5 times in one direction. Now, rinse the sample off the broom in the preservative solution vial by pushing the broom against the bottom of the vial 10 times, forcing the bristles to bend apart. As a final step, swirl the brush between the thumb and forefinger vigorously to further release cervical material. Once rinsed, the broom may be discarded. When using the endocervical brush and plastic spatula combination, the plastic spatula is used to sample the ectocervix, and the endocervical brush is used to sample the endocervix. First, obtain an adequate sample from the ectocervix using a plastic spatula. Then rinse the spatula in the preservative solution vial by swirling the spatula vigorously in the vial. Once rinsed, the spatula may be discarded. Next, obtain a sample from the endocervix by inserting the endocervical brush into the cervix until only the bottommost bristles are exposed. Slowly rotate the brush 1/4 to 1/2 turn in one direction to minimize bleeding. It is very important not to over-rotate the brush. Rinse the brush in the same preservative vial used for the spatula. Press the bristles of the brush against the wall of the preservative solution vial while stirring the solution 10 times. Then swirl the brush vigorously to further release cervical material. Once rinsed, the brush may be discarded. Cap the preservative solution vial. Make sure to tighten the cap until the black torque line on the cap passes the black torque line on the vial. Record the patient's name and identification number on the preservative solution vial. Record the patient information and medical history on the standard cytology requisition form used by your laboratory.
Liquid business cytology are present in the market under 2 trade names. Simbref, we saw the video, and short pass. What is the difference? I am sorry if there is any error in the spelling or pronunciation of short pass. If anyone can correct, no problem. But till now, it is short pass. Short pass here, we need to concentrate about that. The end of the spatula here is broken inside, not rinse, but broken, and we close the vial and send to the lab. But the same principle. We need to say that Simbref have very important advantages. It can detect human papilloma virus of the same setting. So no need to call the patient for detection of human papilloma virus. So one sample for cervical cytology and detection of human papilloma virus, and it is very important one. What are the advantages of LBC over traditional vaccine? The number of adequate test results has fallen from over 9% before the introduction of LBC to 2.5% in last year in United Kingdom, where it is generally applied in the United Kingdom instead of traditional vaccine. This means that fewer women now need a second test, because if pap smear it is unsatisfactory, we obliged to call the patient for another test and worry to the patient and so on. The second, I need to concentrate about LBC has the ability to use the liquid buffer for human papilloma virus testing, and it is very important. The third, reduce the level of anxiety in women because fewer need repeated tests and because they receive their result more quickly. Very important part. When I do pap smear, traditional, only 20% of the cell taken from the cervix to the spatula and from the spatula to the slide, only 20% of the cell. 80% of the cell are lost, while 100% of the cell taken from the cervix to the container in case of LBC, and this will give better result. Regarding if we compare liquid-based cytology versus conventional cytology in detecting cervical cancer, there are many meta-analyses showing that sensitivity of detection of abnormal cytology using liquid-based cytology, and it is superior than traditional pap smear. But recently, The opposite result appeared. Some studies showing that there is no difference between liquid-based cytology and the traditional pap smear in detecting abnormal smear. In spite of the last result, still United Kingdom and many countries using liquid-based cytology, and they shifted completely from traditional one to liquid-based cytology. This is a picture of severe dyscorosis using liquid-based cytology, how it is clear field compared to this traditional. Same diagnosis. So persons shifted from pap smear to liquid-based cytology nowadays in Western countries. Regarding the second group type of detection of cervical screening, as mentioned by our colleagues and will be mentioned, it is human papillomavirus DNA testing, either using PCR or hybrid capture system, commercially available as HEC2, can be used as primary or secondary level adjuvant cytology. It improves the accuracy of the cytology. But till now, the routine use, I stress about the routine use of it, is not recommended, but it is used widely all over the world and increase the sensitivity for the detection of abnormality. Human papillomavirus DNA testing detect presence or absence of human papillomavirus DNA and give quantitative assessment of the viral load, and it can differentiate if it is high risk or intermediate risk or low risk. I need to say that this is the causes of unsatisfactory traditional papillomavirus smear. If we look here, everyone asks himself, can I reduce the rate of unsatisfactory smear? Of course, everyone can do. Yes, I can do by proper technique. The second question, can be prevented? Of course, cancer cervix can be prevented. Thanks very much.